So I think one particular challenge for patients with HER2-positive disease, unfortunately, is brain metastases. So approximately half of all patients who develop metastatic HER2-positive disease will die from progression in the brain. And so there have been much efforts made to try to improve outcomes for these patients. One class of drugs that we've focused on for this patient population has been the use of tyrosine kinase inhibitors. These agents have a lower molecular weight than monoclonal antibodies and are able to penetrate through the blood-brain barrier. And so there have been several trials done looking at these agents. A few trials would suggest that when you combine tyrosine kinase inhibitors with capecitabine, the response rates do seem to be much greater and maybe as high as even 60%. So now actually the NCCN has added it to their guidelines to consider the use of capecitabine and neratinib in patients who have progressive disease in the brain. So I think clinical trials are a great opportunity for patients because it allows them to get novel therapies before they get approved. And so it really gives them an opportunity to get a new agent that may have very promising activity earlier than they would normally have access to it. And so usually when I'm seeing a patient, I like to always present what the standard option is so that they're very well aware of what they could get outside of a clinical trial, but also discuss what the clinical trial option would be at that time and see what makes more sense at that particular moment. Because it's not always that the clinical trial is the right decision for them. And so it's important to weigh the pros and cons of that approach.